So we're going to talk about ketamine and other dissociatives today. I don't have any financial disclosures. Objectives today at the end would be to be able to describe why patients use and misuse dissociatives and identify risks associated with the use of dissociative drugs or medications. So today we're going to talk about four main dissociatives: ketamine, phencyclidine or phencyclidine. I'm not sure the best way to say that, but more readily known as PCP, which is a lot easier. I'll call it that from now on. Dextromethorphan and nitrous oxide. So the desired effects that patients or people want to get from dissociatives and why they use them in a recreational manner would be to try to achieve an out-of-body experience. Sorry for background noise. Also maybe some euphoria and happiness, relaxation, and then also visual and auditory hallucinations. From some of the kind of anecdotal studies that have published some subjective reports from people, it would be like melting into the surroundings. Some people say they just use them to chill out or not think about things, escape certain conditions or things that they have going on in their life. Unfortunately, as with any drug, adverse effects also come along with use, and some of these can be rather significant sometimes. So confusion, agitation, tachycardia, hypertension, slurred speech, blurred vision, anxiety, paranoia, violence can occur, as well as vomiting. And these are just kind of general that can be associated with many of these, but we can get into some more specifics here in a couple minutes. So this is the SAMHSA 2020 report, a survey that they do of drug use. And so we can see that hallucinogen use, which is what they kind of classify these drugs that we're talking about today under, for people that are 12 and older, has not really gone up significantly, especially, compared to some of the other drugs. It's been a pretty steady trend. Now, you can see there's not a line connecting these. And as you can also see, ages 18 to 25 use them most frequently. But there's not a line between the 2020 and 2019, and they specified that's because the methods to obtain the responses to this were a little bit different because of the pandemic. So these numbers may not be as high fidelity, I guess, is what they normally get from year to year. But again, there's not really a trend up or slightly up, but not anything super significant over the past few years. All right, so we're going to start off with ketamine. So it was first introduced in the 1960s for anesthesia and pain. It was the most commonly used medication during the Vietnam War for kind of combat medics and things like that. Medically, it can be used for anesthesia. It's used off-label for depression. And then status epilepticus, if it's refractory to everything else, it can be used off-label. It gained popularity as a rave and dance party drug recreationally, and the straight names can be Special K, Ket, Kit Kat, Super K. The mechanism of action, and what we'll see throughout the mechanism of action for multiple of these dissociatives is an NMD receptor antagonist. Ketamine also works on glutamate, or it's also a glutamate receptor antagonist and a partial agonist at mu-opioid receptors. One of the reasons this is used as an anesthetic is that it does sedate people, but does not sedate like respiratory drive. So that is super important and why we use it, or circulation, and that's why it's used frequently. Adverse effects, these are pretty much the ones that were listed before, but impaired motor function, sedation, confusion, tachycardia, hypertension, slurred speech, blurred vision, anxiety, panic, violence. When this is used, and we'll talk just a brief bit, so S-ketamine has been approved for depression by the FDA, and you have to monitor the patient for 2 hours in the office because of this impaired motor function and also risk of hypertension, which is one of the biggest side effects of ketamine. So you do need to monitor that, and it shouldn't be used in patients that have uncontrolled hypertension or could have serious complications from uncontrolled hypertension, such as if they were at increased risk of having like a hemorrhagic stroke or something like that. For chronic use, one of our main side effects is going to be either interstitial cystitis or ulceration of the bladder. And this is a really serious side effect that occurs with frequent ketamine use. And they're not really 100% sure on what the mechanism is behind that, but it can be serious. And then a small subset of people can have persistent psychiatric symptoms from ketamine after using it. So again, some of those desired effects that people, when they misuse ketamine, are looking for, like hallucinations and things like that. And some of those hallucinations can continue even after the drug has left the body. For onset, it depends on how the drug is administered, but if it's injected, less than 1 minute, snorted or smoked would be 5 to 15 minutes, and then swallowed greater than 30 minutes. Most of the time when it's used recreationally, you're going to see it either snorted or smoked, and sometimes swallowed as well. The desirable effects last for about an hour in most people. However, again, that can be prolonged in others. And then for the effects on the coordination and senses can last for up to 24 hours, which really can kind of get in the way of some of its therapeutic effects if you are using it for, say refractory depression. For metabolism, it's mostly hepatic. There's multiple mechanisms that it undergoes. I didn't even want to list out all of them. There are a couple CYP enzymes, but there's also glucuronidation and several other pathways that would get really extensive to talk about. It does undergo extensive first pass metabolism. So if it's swallowed, a lot of the ketamine is not even going to make it into the bloodstream before it's metabolized. It's eliminated via the kidneys. And there are some significant drug interactions, specifically like 3A4 inhibitors and inducers and CNS depressants. It does have a really rapid onset and a short half-life, and duration, and that enhances or that contributes to the misuse potential of ketamine. Acute treatment with ketamine leads to increases in dopamine. So again, that kind of lends itself to misuse. Tolerance does develop with regular use. So as people use it, they need higher doses in order to get the same effects. And remember, I said that there can be lasting psychosis. About 3% of frequent users have that lasting psychosis even after the drug has left their system. There are withdrawal effects for frequent users. However, there's not like a set syndrome of like, these are the symptoms that are experienced by people. It's kind of non-specific symptoms that people feel. And a lot of times ketamine can be combined with other drugs. And so it's a little difficult to parse out, is it the ketamine withdrawal or is it something else? And then for continued use over a year, you can see more and more cognitive impairment, specifically with spatial working memory, pattern recognition. There can be deficiencies in mental and motor skills and speed, visual and verbal memory, and executive function as well. And so this is somewhat concerning, especially if we're thinking about using this for chronic use if people are thinking about using it for depression, like chronic users or something like that. And that was from a very specific study, or a couple of studies that they actually looked at for those continued use greater than a year. Now, as far as, like I said, depression goes, there have been multiple studies showing that IV ketamine, even one dose, reduces suicidal ideation. So it does seem to be really effective for that suicidal ideation. Along with that comes those CNS side effects, the confusion, the issues with motor function. So if somebody does receive these, it's basically going to be an entire day off of work or whatever activities that they have going on, because it's kind of hard for them to continue that. So drug manufacturers were able to isolate the S enantiomer called S-ketamine, and they were able to make that into a nasal spray. And that is what has gotten the FDA approved indication for treatment-resistant depression. People that have tried multiple different kind of first-line agents can try the S-ketamine. It's 4 times more potent at NMDA receptors. And it's so, the hope was that you could use lower doses of S-ketamine than you could ketamine. It is intranasal, and it was approved in 2019. Again, when you do administer that, it has to be under the supervision of a physician. You do need to check vitals. That's very important. You need to make sure that the patients are supervised over that time, and make sure that they don't have extreme hypertension or anything like that. But There is a meta-analysis that was undergone to kind of compare. Oh, I think I had some some autocorrect or something go on there. Ketamine versus S-ketamine. And the racemic ketamine worked much better than S-ketamine for depression. So you can see the overall response was basically almost 3 times as good with the racemic mixture versus S-ketamine. Remission rates were almost 3 times as good, basically. And then there were a lot fewer dropouts with the IV ketamine versus S-ketamine. All right, moving on to PCP. Ketamine is actually a derivative of PCP, which is really interesting. PCP was withdrawn from the US market in 1978 due to schizophrenomimetic effects and abuse potential. In the 80s, it was a really popular drug of misuse or abuse, and it reemerged again in the early 2000s. Street names are angel dust, PCP, supergrass, tic tac zoom, peace pill. It's a really complex mechanism of action. I was like, how do I distill this down? And there are just so many things that are going on. It involves NMDA, glutamate, GABA, dopamine, norepinephrine, all working at different parts. And then the NMDA and glutamate both have some agonist and antagonist, depending on kind of where in different pathways it's at. It was really tough. I honestly don't even fully understand it. So what you'll see PCP used as white powder tablets, liquid as well. A lot of times they'll take the liquid, which is kind of an oil, and lace cigarettes or marijuana with it and then smoke it. It can also be snorted. Onset, there's about 2 to 5 minutes. It can be ingested, which is about 30 to 60 minutes, or it can be injected as well. Also hepatically metabolized and undergoes extensive first pass metabolism. I thought it was interesting looking at the different doses and what effects that we see from those. So PCP can cause people to get really violent, and they can also fluctuate between these states of very sedated and then very activated, agitated, and violent. So between 1 to 5 milligrams, you'll see the sedation, sometimes violence, slurred speech, and potentially seizures. From 5 to 10, that's where we start to see more hallucinations, acute schizophrenic symptoms, agitation, psychosis, paranoid delusions, and catatonia. And then over 10 milligrams, patients can go into a coma. So I will say so I kind of am hitting these baselines. So if there's any specific information that you all want to know more about, please feel free to ask. I might need to do a little bit more research and get back to you as well. I was kind of trying to figure out what's the best information to include for you all, and kind of just came on, let's just do a general overview and we can address any specific questions after that. So dextromethorphan, street names for this, DXM, some people call it robo-tripping or skittling. When I was in pharmacy school about, well, gosh, how long ago was that now? 7 years or so ago, people were like filming themselves going into like CVS and like opening dextromethorphan and like chugging the whole bottle. It was a weird like viral trend thing that was going on pre-TikTok. Brands that you'll see, Robitussin, Coricidin, generic cough syrup. Here's just kind of a picture of a generic cough syrup that people would do now. Dextromethorphan is structurally similar to codeine. Again, blocks NMDA receptors, binds serotonergic receptors as well. It is a prodrug that requires CYP2D6 to work. So people that have like rapid metabolism via 2D6 can experience kind of the euphoric effects or dissociative state from dextromethorphan more than regular people that just have kind of normal 2D6. And there is some tachyphylaxis, which basically means, tolerance. If people use it frequently, then they're not going to get the same level. So the dissociative state, you've got different like levels. So 100 to 200 milligrams, you get a mild stimulant effect. From 200 to 400, it's similar to alcohol or marijuana. So it's a little bit more sedating. For 3, that's when you get the dissociative state similar to ketamine. So I didn't mention this during ketamine, but when we were talking about ketamine, but if you get to that dissociative state, they call it falling into a K-hole, which is just kind of, again, kind of that blending into the surroundings. And then from 600 to 1500 milligrams, that is where you get the full dissociative state or out of body experience, where you feel like you're floating above your body. So adverse effects from dextromethorphan, tachycardia, hypertension, vomiting, diaphoresis, nystagmus, moderate intoxication, hallucinations. There's a distinctive kind of plodding walk that people have. And then severe, you can get agitation, somnolence, hyperthermia, metabolic acidosis. And there is a risk of serotonin syndrome, especially if you have somebody that's already taking antidepressants or other medications that increase the risk for serotonin syndrome. Things other than antidepressants that you would want to watch out for there, tramadol, linezolid. Those are two that kind of pop into my head right off the bat. All right, and then nitrous oxide or laughing gas that you get at the dentist. This has been used as far back as the 1800s for like recreational use. Medicinally, it's used for anesthesia, analgesia, and it's kind of an anti-anxiety as well. It's also used in cooking or baking for like whipped cream and things like that. You can see it for carbonation for beer, like again, a stout or something like that, or nitro coffee, anything, any, pour that you get of something that has nitro, that's the nitrous oxide. The way that people use this, there's little cans called, I guess, whippets is what they're generally referred to as. You can inhale it directly from the can, which is really dangerous. You can inhale it take it from the can, put it into a balloon, and then inhale it from a balloon. Some people put a plastic bag over their head and put that in there. And so there've been a lot of deaths associated with that from asphyxiation from the bag. Apparently the band Grateful Dead were really big into nitrous oxide, probably along with other drugs. But there was an interesting New York Times piece that I was reading about nitrous oxide. I guess it's really popular at Burning Man and in Silicon Valley. A lot of tech executives and stuff misuse nitrous oxide. Steve-O from Jackass was actually in that particular New York Times piece and talked about his addiction and struggles with nitrous oxide. Street names for it: whippets, hippie crack, laughing gas, NOS or NOS, chargers, balloons. And the mechanism again is you've got the NMDA GABA agonist, and then it also promotes endogenous opioid release, acting as a partial agonist. So naloxone can reverse the effects here, but generally it doesn't suppress the respiratory drive like pure opioids do. With nitrous oxide, there are some really scary things. If somebody has like low B12 or borderline low B12, you can have irreversible neurological or psychological symptoms, including numbness, weakness, paresthesias, psychosis, cognitive impairment, etc. And in that article that I was reading from the New York Times, Steve-O specifically was saying that during his addiction, all he wanted to do was be using nitrous oxide, and he would even he tried not to breathe for as long as he could and just breathe in nitrous. And he said it was the weirdest, like a very strange addiction, because it was like he just kept desiring it and just could not. He was like, he kind of wanted to die too. I don't know. I know addiction is very complex and some people probably feel that on other symptoms too, but the way he was describing it was really interesting. So if you can find that, I encouraged reading that article. Thought it was very interesting. So a review of neurological case studies with nitrous oxide: 91 neurological manifestations. Most were treated with B12. 10 of them fully resolved, 46 improved but didn't fully resolve, and 3 persisted. And there were 29 deaths out of some of those, mostly asphyxiation again, from a lot of those from bags over the head. Psychiatric symptoms: 13 delusions, 6 cognitive impairment, 4 visual hallucinations. I won't read those, but you can see that there were some lasting psychiatric effects from that as well. All right, so in summary, dissociatives used for euphoria, relaxation, visual hallucinations, and out-of-body experiences. Ketamine is a medication with legitimate medical uses, but it also has misuse potential and is available on the street. And then regular dissociative use may result in both persistent neurological and/or psychiatric symptoms that can last long.